Welcome to my YouTube channel, RN Medicina. Please subscribe. Today our topic is anatomy and physiology of pharynx.
The pharynx is a tube 12 to 14 centimeters long that lies posterior to the nasal and oral cavities, superior to the larynx, anterior to the cervical vertebrae. It ends up at 6th cervical vertebra. Its wall is composed of skeletal muscles and is lined with the mucous membrane. Relaxed skeletal muscles help keep the pharynx patent. Functions of pharynx. 1. Passageway for air and food. 2. Speech. Provides a resonating chamber for speech sounds. 3. Protection. Houses the tonsils, which participate in immunological reactions against foreign invaders. 4. Taste. 5. Hearing. 6. Warming and humidifying air. Pharynx. The pharynx can be divided into 3 anatomical regions. 1. Nasopharynx. 2. Oropharynx. 3. Laryngopharynx. See diagrams. Nasopharynx. The nasal part of the pharynx lies behind the nose, above the level of the soft palate. Five openings in its wall. 2 internal nares. 2 auditory, eustachian or pharyngotympanic tubes. 1 opening into the oropharynx. The nasopharynx also exchanges small amounts of air with the auditory tubes to equalize air pressure between the middle ear and the atmosphere. On its posterior wall there are the pharyngeal tonsils adenoids, consisting of lymphoid tissue. They are most prominent in children up to approximately 7 years of age. After 7 years, gradually atrophy. Oropharynx. The oral part of the pharynx lies behind the mouth, extending from below the level of the soft palate to the level of the upper part of the body of the 3rd cervical vertebra and hyoid bone. The lateral walls of the pharynx blends with the soft palate to form 2 folds on each side. Between each pair of folds there is a collection of lymphoid tissue called the palatine tonsil. During swallowing, the nasal and oral parts are separated by the soft palate and the uvula. It has only one opening into it, the fauces throat, the opening from the mouth. Laryngopharynx. The inferior portion of the pharynx, the laryngopharynx or hypopharynx, begins at the level of the hyoid bone. It extends from the oropharynx above and continues as the esophagus below, that is from the level of the third to the sixth cervical vertebrae. At its inferior end, it opens into the esophagus food tube posteriorly and the larynx voice box anteriorly. Like oropharynx, the laryngopharynx is both a respiratory and a digestive pathway, and is lined by non-keratinized stratified squamous epithelium. Structure of pharynx. The pharynx is composed of 3 layers of tissue. 1. Mucous membrane lining or mucosa. 2. Fibrous tissue. 3. Muscle tissue. Thank you for watching. Please subscribe my channel for more medical related information.